After the surgery, your pain will be managed first by the anesthesiologist and then on the floor by the nursing staff. We will utilize IV pain medications as well as oral narcotics. Once you are home, we will give you a prescription for some oral narcotics to take, but ask that you fairly quickly transition to anti-inflammatories such as ibuprofen or Aleve, and utilize Tylenol when you are off of the oral narcotics. After surgery, it is very important to limit the amount of swelling so that you can have the best recovery. We ask that you do icing to the area while in the hospital, which will be run by the nurses. When you go home, we ask that you do the same thing for the next 72 hours or so. Icing can help really reduce the swelling. Additionally, we ask that you don't do anything strenuous or heavy lifting, and that generally speaking, other than gentle walking, you don't do any significant activity. Your incision site will be glued shut. Underneath, there is absorbable suture material. We ask that you do not scrub that area when you are allowed to start showering at approximately 48 hours after the procedure. We do not ask that there is anything particular to be done in this area, as the glue will fall off and the suture material will fall out. By using the penoscrotal approach for placement of the penile prosthesis, generally speaking, I do not require you to pull the pump down into the scrotum because it is in good position. Constipation is a common problem when utilizing narcotic pain medications. One of the ways that you can limit the amount of constipation you have is by utilizing the stool softener that we send you home with. In addition, once you are able to get up and move around, the more you are able to gently walk around, this can help move your bowels. We do have a few restrictions after the penile prosthesis. I ask that you do not shower for 48 hours. You may soak in a tub only after I clear you, and that is typically at 2 to 3 weeks. As far as strenuous activity and lifting, I ask that you simply don't do anything strenuous until I clear you at 2 to 3 weeks, and nothing during that 2 to 3 week other than walking around gently. When a person has a penile prosthesis placed, it depends on what their work is and how they are recovering as far as when they can return to these things. I do ask that you do not drive while you're on any pain medication. Otherwise, I think it is very reasonable to drive once your pain is controlled enough that you do not need pain medications. Also, I would suggest that your work dictates when you go back, and if it is a strenuous work, for sure 2 weeks and possibly longer, depending on your recovery. Nothing more than 4 to 5 weeks would be routine, and most people can get back to work fairly rapidly within the first week or two. This can be discussed, and you can get a release from my office at the appropriate time at your 2 to 3 week wound check follow-up. Typical recovery for a penile prosthesis placement is again dependent upon the individual and how the individual recovers, generally speaking, from any anesthesia procedure. If you are someone who takes a longer period of time to recover or has constipation and difficulties therein, this may be harder. Most people, generally within 2 to 3 weeks, are feeling reasonably decreased amount of pain, and by 4 weeks we allow the individual to use the device, so pain is very reasonable at that point. Between 0 weeks and 4 weeks, it is variable, and plan accordingly that it may be variable for you as well. While complications are rare after a penile prosthesis placement, we do want to have you call with any questions that you are bothered by. Particularly, I would like to know if you have any significant beefy red or drainage coming from the incision. Fever is also something we would be concerned about at 101.5 degrees Fahrenheit. Also, if you are having pain that is worsening and not controllable, we would like to know about this as well. Generally speaking, if you are uncomfortable or have a question that you feel needs to be answered before your next follow-up appointment, please call, and either our nursing staff or myself can give you an answer. After your surgery and before you are discharged home, oftentimes we will make your follow-up appointment. That will be at typically 2 to 3 weeks. If your surgery is at the end of the week and you are discharged on the weekend, you may not have your follow-up appointment made. When you call our office on Monday morning, I would recommend that you simply state that we need a follow-up appointment after surgery 2 to 3 weeks from the time of the operation. If there are any questions, of course you may talk to a nurse at that point in time. After the penile prosthesis, you can utilize the device at approximately 4 to 5 weeks. We will teach you how to inflate and deflate the device at that visit. If you have any difficulties with learning this, we will then bring you back until you feel comfortable. We understand that the reason that you had this implanted is to utilize it, so we think it is very important that you learn to effectively utilize your own device. During your recovery period, if you have any questions, I do ask that you call our office. You can always leave a message with our nurse who will get back to you within a reasonable amount of time. And if you have questions that can only be answered by me, I will either call you or we will arrange a sooner appointment for you to visit with me and be seen.